Hi everyone, I'm Ian Harvey, massage therapist. Last week I got an email about how to work with tech neck. Tech neck isn't something that you'll find in a medical journal. At least I don't think so. Rather, it's a constellation of symptoms that you might find in someone who spends a lot of time at a desk or working with devices. This tends to be things like headache at the base of the skull, neck pain, shoulder pain, and even wrapping tension headache. We'll spend some time talking about what might be going on anatomically, what's going on in the client's body. Then we'll get a client on the table and do a long, luxurious demo. Then I'll show you a stretch that might be useful for your clients to work with some of this through their workday. If you'd like to skip ahead to any part of that, click down in the chapters. By the way, I also have another video today just for my Patreon supporters. It's about how to work with the scalenes in a kind and gentle way. Scalene work doesn't have to suck. And I also wrote a book for massage therapists about avoiding burnout and communication and living your best life. You can read more about that at massagesloth.com/book. So when I talk to people who have these symptoms, this posterior neck, cranium, shoulder stuff, they tend to be office workers, students, teachers, dental hygienists, and anyone who has to be curled toward their work surface for 8+ hours a day. And that gives me an idea of what must be going on with their body. If they're spending, 10 hours a day in this protracted position, their shoulders are forward, their head is forward, their shoulders are rolled in, and it's all having to stay stable, that can send a powerful message to their nervous system that this is what I need. As time goes on, this can become more and more set in, and anything else, like standing up straight, can feel uncomfortable. In fact, being in this position for so long and having your body reinforcing this position can eventually just be kind of uncomfortable. It can make all of these anterior muscles quite tight and make all these posterior muscles used to being very long while being very strong. So they're having to put up with poor leverage, and sometimes that creates some irritation or just some sensitization. You might be noticing some common themes with the video from last month, which was about that damn spot, and it's that there's a tug of war going on. The front is staying short and strong, the back is staying long and strong, and the nervous system has gotten the idea that this is the new normal, that this is what's necessary. And we as massage therapists can convince the nervous system via the body that this is normal as well, and that all of this tension that's been building and building isn't necessary. Sure, some tension is needed to do this, but it doesn't have to be quite so powerfully tugging on the base of the skull. So that tug of war between front and back and that 10 hours a day of being hunched over a work surface, that's the likely cause of this, but what's going on anatomically? Well, we've got trapezius, which is latched on at the base of the skull. When trapezius is long and having to stay tight and strong, that can create pain here, and that can have that wrapping sensation that can end up in the frontal region of the face as well as the eyes. So if someone has pain here, ask about here, and vice versa. The paraspinal muscles are likely involved as well, and we'll work with all of those at the same time. We're likely dealing with short and strong pecs, including pec minor. We've also got these anterior neck muscles like SCMs and the scalenes that are staying chronically shortened, and so when people stand up straight, that can feel a little bit uncomfortable. So you've got a client who walks into your treatment room, they say, I've got pain back here, they say, I work at a desk. Some questions that I would like you to ask them. First of all, do you have that wrapping sensation? I think that that's important to know. Second, do you have anything going on with your jaw? Any clicking or popping or anything like that? If they do, then I start to become curious about all this stuff and about the SCMs. I'll also ask, do you ever wake up with a crick in your neck where you can't quite turn your head? If that's true, then they very likely have stuff going on with their levator scapula muscles. So these are all good things to know, but even if these aren't hits, even if the client doesn't have this other stuff going on, I think that you will still be well served by being thorough. If you are the first person to work thoroughly with the neck shoulders, pecs, etc., then you might be the first massage therapist to do that. And I think that most clients will, on a just instinctual level, realize how valuable all this stuff is. By the way, you might have people walking into your office with a complex about their posture, like, oh, my posture sucks, I shouldn't be doing this at my desk. And what I would like to tell all those clients is that your body adapted. It did what it needed to do to survive, to keep you strong and able to do that difficult job that you're doing. But we can send a different message. We don't have to reinforce that your posture sucks thing. We don't have to give them that medal of worst posture ever. They don't need that. Instead, we can let them know that this can change. And even if the posture doesn't change, the pain can change. So maybe we can choose not to reinforce that self-stigma and let them know that their body is resilient and that it can adapt again with new stimuli. So let's get a client on the table and see what this looks like. This is my friend Ashley.
Hello.
And when I've got someone with complicated neck, shoulder, head stuff going on, I do like to start them face up. And the reason is that that gives me plenty of time to explore and be thorough. Versus when I start them face down, sometimes I'll get done with the back, I'll get all the way through the legs and through the arms, and I'll have 5 minutes left. And that's not nearly enough time, in my opinion, to really affect this area. First things first, if I've got a client who has frontal headaches or headaches behind their eyes, or if they have any of this temporalis stuff going on, or jaw pain or clicking or anything like that, then I do like to start my massage here. The reason is that I have nice clean hands and I don't have any oil at all, so I would just be using the naturally occurring oils on the face, which allows me to go nice and slow and really grab this fascia. And I'm going to kind of just glance over this part of it for the purposes of this video, but if you have someone with those wrapping headaches or jaw involvement, do make sure to make contact with the face. Next up, we're going to get some oil on our hands. I've got just kind of a half pump of jojoba oil. And then I'm going to start with some big, beautiful warm-up of the shoulders, trapezius, pecs. Just using big, encompassing hands. Notice the movement of my torso. I'm not allowing this to just be static in any way. I can use paired fists. I can do petrissage. If we can get the client's head starting to rock ever so slightly, then that's going to set the tone for the rest of this session. I'm including some traction of the neck going all the way up into the scalp. It's always good to get your client's permission before messing up their hair too much. I am pressing in with my heels of hand, and I am rocking my own body. And notice the movement that starts to happen. What I want to do here is tell the story of how all of these structures are put together. That the trapezius is part of the neck. It's an important part of the posterior neck musculature. And a way I like to kind of cap this off is to maybe add a little more oil to my hands, stand up myself, and compress either pec major region. And we are, of course, including pec minor with this because there's no way not to. Notice how I'm leaning away from my own hand. So the hand that's pressing, I have leaned to the other side. That gives me maximal leverage, and it makes this very easy for me. And then we can sit and do another nice broad swoop into the posterior neck and skull. Before I move on, notice how pressing on either side like this draws the head in that direction, and that makes me wonder, what is the connection here? What is this fascial connection between this upper chest and the neck? And what could too tight pecs mean to a neck that just wants to feel some freedom? I'd like to spread this area out, and I think that that'll help the neck feel more comfort. And then I'm going to come to one side of the table. We're going to do a technique that I jokingly call the Harvey maneuver, but then it stopped being a joke. Anyway, this is the Harvey maneuver. So your fist goes in this soft, squishy part of the trapezius, and your palm goes over top and spreads outward like this. So fist goes in and up, palm goes out and down. That looks like this. Notice how I'm keeping my elbow nice and high. That keeps my arm out of her face and gives me some free leverage. And note how it's just kind of gently encouraging her head to roll away from me. Do that a couple of times, and we'll have quite a bit of useful real estate. This is also speaking to that pec-neck connection that we were just talking about. If we take this fascia and drag it in this direction, while using this fist to take this sheet of fascia and drag it in and up, that's going to tell the client's nervous system a bit about how they are connected. And it might even allow the body to keep this from being such a strong connection, that this doesn't have to dictate what happens here. From here, I can stay over to this side, and now I've got all of this neck, all of this trapezius available to me. I could come down here and put this arm in a cradle and work with the pecs. I could work with the rotator cuff. And that will all be relevant to this tension. Once we've got this arm uncovered, we can do some nice traction down. We can do some more effleurage and petrissage from this new area. And notice all of this mobilization that I'm doing. A lot of this is coming from my body. I'm going into lunges. I'm backing away. I'm using my body weight to do this traction. And then we can bring the arm up like this into a field goal position. And we're rotating outward as this broad palm does a nice big myofascial swoop outwards. So think skin. Rather than mashing on pec, we're taking all of this pec skin, we're giving it plenty of pressure, but a lot of that pressure is out. It is lateral. So we're creating fascial traction outward. So now that we've done plenty of warming up, we've done mobilization, we have worked with the pecs, we have moved the arm, we might have even done some specific work with the pecs and the rotator cuff, I think that we would be fully justified in being more specific with our trapezius work. We can make a trapezius sandwich that looks like this. We are using 2 duck grips, quack quack. So nice straight fingers. We're not pinching here. We're drawing muscle into this shape. And that looks like this. We want to get as much of this muscle as possible between our fingers and our thumbs. And then we do a little bit of compression, whatever's comfortable for your client. Track your client's face, make sure that they are comfortable. And then we simply wait. This is another form of myofascial release. We're drawing that fascia up into our hands. A cup would be great for this purpose. Cupping kind of creates a radial form of fascial traction where it grabs the fascia from all directions. And that's kind of what we're doing here. And we are compressing this tissue as well. So the trapezius is getting a lot of interesting new stimulus here, but it's also getting a message of calm and soothing. And what I expect to happen after about 20 to 30 seconds is for this area to melt just a bit. And that's exactly what I'm feeling. I'm noticing this trapezius become softer and more pliable. My thumbs are getting closer to my fingers. And that's without me having to press harder at all. If this isn't enough for some clients, if they're not really feeling much of anything, you could have them do just a little bit of movement. So Ashley, using a very tiny range of motion and going very slowly, I would like you to shake your head no. Just very small movement. Good. And you'll notice movement between your fingers and thumbs. Planes of fascia are sliding past each other. Some muscles are firing, some muscles are going quiet. And once again, this sends a very interesting set of stimuli to the nervous system. And in my experience, it can have the person stand up from the table and be less likely to have their shoulders up toward their ears. And actually, you can let your head rest. So, what I'm feeling here is soft, it's mushy, it is warm. And if that's something that I can accomplish in 30 seconds without working too hard, then why wouldn't I? And now that this area is nice and warm, it is extra easy to palpate the superior angle of the scapula. You will feel a little finger-like projection of bone that is the very topmost portion of the scapula, and it's also where the levator scapula inserts. So, feel for that knob of bone. If you would like help finding this, I have a past video on levator scapula. I'll link that down in the description, and it includes some help with self-palpation. Once you find this on yourself, you'll much more easily be able to find it on clients. From here, we can simply follow these transverse processes. If you're on the transverse processes of the cervical spine, you are on levator scapula. And that looks like this. I have one hand crossed over the other. I find a good place to press, and I sink in and I wait. I don't have an agenda here. I'm not waiting for this to become softer. I'm not trying to dig. Instead, I'm just acknowledging this muscle all by itself, which is very rare. People don't know that they have a levator scapula muscle, and it's something that we can demonstrate to them and describe to them. We can do that without saying a word, or we can choose to, clue them in. If they've got neck cricks, then it could be very useful to know that, hey, there's a source for these. So I'm following all the way up toward the base of the skull. Levator scapula has a different texture than all of the surrounding muscles. Another way to know that you're in the right place is to notice that you are posterior to the sternocleidomastoid, the SCM, and that you are in front of trapezius as it becomes very thin and ribbon-like. So think of this as a fascial pin and stretch. I am pinning the fascia with this lower hand, the hand that's on the superior angle, and then I'm just scooping the fascia away from that pin using my fingers. And I'm not using this finger just because there were too many fingers. So I narrowed my tool slightly. And then you can bring it all back together. And finally, I'd like to work with the sternocleidomastoid. I think that working directly with this muscle can be fairly powerful, not just for jaw stuff, not just for this one muscle, but more broadly. By working with this fascia, we're scooping up all of the nearby fascia. And I do like to have a conversation when I work with this muscle, and that'll sound something like this. So Ashley, I'd like to work with this ropey muscle on the front of your neck. It might feel a little bit funky, but it shouldn't be just unpleasant. So if you just don't like it, please let me know, okay? All right, thank you. And it can be just that quick and easy. But do make sure to monitor your client's face, track their breathing, and if there are any signs of discomfort, then back off and ask how they're doing. So this is how I like to work with the sternocleidomastoid. You might have seen some other practitioners who turn their head to the side, have them raise their head off the table, and then grab all the way around it. And that is a perfectly fine way of working with the sternocleidomastoid, but for a lot of clients, I think that that can feel a little invasive and a little bit direct. Instead, I want to do something that's very gentle for this muscle that is not used to a lot of direct contact. And that looks like this. I use the side of my finger to lift from the posterior portion of the SCM. Notice how that makes it stand out. Then I reach my thumb over top. I grab more skin than I need to. So I'm not just lifting and then placing my thumb here, because then the SCM would squeeze out of my hands. Instead, I lift up. I reach way over, grab some extra skin, and then I compress the SCM against this broad surface of the outside of my finger there. And this should feel like a hug. All we're doing is hugging the SCM rather than trying to pluck it up. We're not trying to dig anything out. We're not trying to give it all sorts of compression. Instead, we are simply acknowledging it. And this, I think you'll find, can have a pretty profound effect. You might feel that myofascial distinctive feeling of the melt, where this muscle becomes softer and softer, just with this minimal contact, just with this acknowledgement. And Ashley, doing okay so far? Mm-hmm. Okay, good. And for this, because it requires patience and time, I recommend that you, as the massage therapist, take some breaths yourself and take your time with this. If you find that you've got too much oil on your hands for this, then you might slip away. In that case, just reset, maybe in a different place, and repeat. There's lots of good places to make this hugging contact. And from here, we can smooth it on out. I'm just using big, broad surfaces of my finger pads, of the palmar surface of my phalanges. And I'm thinking skin. I'm not pressing toward her throat. I'm dragging away from it. That can often feel comfortable in ways that more direct pressure would not. And I'm ending at the heck is this thing called? Mastoid process. I remembered it. I did it. And then I'm just going to linger there. I've got the tissue dragged up toward the top of her head. And again, this is another place where we can wait for softness and for heat. So I've worked with each side individually. I've come back to the head of the table. I've brought things back together with some more bilateral petrissage and mobilization. And then when I don't have much oil on my hands left at all, because it's spread, it's been absorbed, I like to do a chest and anterior neck stretch. This is something that I like to do for just about anyone who has neck stuff going on. And that looks like this. I start with this part of my hand, the karate chop part. I place my hands in this configuration, and I start like this. I lead with the edge of my hand. I travel just slightly south of the clavicles, not too far. I don't want to go too far past the drape line at all. And Ashley, do you feel a very slight stretch on the front of your neck?
Yes.
Okay. And this could be the entire contact. I could wait here for 30 seconds. I could invite my client to breathe. And for clients who might like a little bit more intensity, or if you think they just might benefit from the movement, you can say this. So Ashley, go ahead and tilt your chin up very slowly until you feel just a bit more stretch in the front of your neck. And then I would like you to very slowly turn your head from left to right as if you were saying no. And if they do this any quicker than this, then just slow them down. What we're doing is we are shifting the plane of this fascial traction. They should feel a shift in how intense it is from left to right. What this is doing is grabbing all of this fascia on the front of the neck, including the fascia that surrounds and encompasses the muscles of swallowing, the muscles of vocalization. So this can be a nice indirect fascial stretch for all of those deep muscles. And come out of this as gently as you went in. If you find that your hands are drifting down, if they're going further past the drape line than you would like, simply reset. There's no need to be perfect about any of these myofascial release type contacts. It's okay to reset your hands or change tools. And I like to end this with a lovely cranial cradle. And a cranial cradle can be as simple as this. Just finding a place for your hands, giving them a little bit of curvature, and just waiting. I like to do something a little bit more elaborate because that's who I am as a person. And that looks like this. So you can come at this from the sides, you can come at this from under the body. Either way, we're going to be stripping up either side of the cervical spine. I'm leaning my own body back, and that's allowing my fingers to progress. And then when my fingertips reach the base of the skull, then I create that curvature, and I bring the palms of my hands underneath her head. So I now have 10 points of contact. I've got my fingertips, and I've got the sides of my palms, and all of these are suspending the cranium in place. And it creates a kind of bed of nails phenomenon, where there's a bunch of little supports, and they add up together to feel very broad. It can result in a kind of floating sensation. And this is a wonderful contact to hold for a full 30 seconds or more. And then come out of this as gently as you went in. I'm going to let my fingers melt and then sneak out the sides. So that's about what a quasi-myofascial release routine would look like for tech neck. And something that I want to emphasize is that you don't necessarily need to do everything that I did there. If you only have 15 minutes or 10 minutes, you can still get plenty done just by mobilizing, by remembering the pecs, and by doing a little bit of inclusion of this anterior neck stuff. Something that you might be able to do for your clients, depending on local legislation and your scope of practice, is to recommend stretches. And my favorite stretch to recommend for anything going on in this area looks something like this, and I'll tell you how I explain it to clients. So I'd like you to clasp your hands behind your back, and now your arms don't really have to do anything. We're going to pull the shoulder blades together, back and down. It'll feel like you're sticking your chest out. If you feel a bit of a stretch right here, then you're doing it right. And then we're going to very gently, using a tiny range of motion, lean the head from left to right. Just a very gentle tick-tock motion. You should feel this very subtly down into your neck and into your shoulder. Do that about 10 repetitions, back and forth. And then we're going to tuck. We're going to tuck the chin. So think of an invisible finger pressing your chin toward your own neck, and then release. We're going to tuck and release. You should feel a very subtle stretch on the back of your neck. If you are giving yourself a double chin, then you're doing it right. And just do that about 5 to 10 times. Then shake it out and go on with your day. And notice how this works with everything that we've been talking about so far. This stretches these pecs, it stretches the pectoralis minor. The tick-tock works with the levator scapula muscles, and all of these tucks work with these anterior neck muscles. And the most important thing when you're giving a stretch to your client is to give them a time to put it into their life. If you just tell them to do it, they'll maybe think of it once or twice. But if you tell them a time to do it, then that becomes much easier to actually implement. I like to tell my office worker clients to do this every time they get up to go to the bathroom. Or they could set a timer to get up every 2 hours or something like that. Do this stretch and maybe do some other movements to let their body know, let their nervous system know that this isn't all they need. So that was my routine for tech neck. Let me know what you think down in the comments. Let me know if you have any questions. Consider subscribing. Think about my book, and I'll see you next time.